Alfred Laura played with the New York Philharmonic Orchestra for 38 years. Shortly after retirement, he realized he could not read the sheet music in order to play his beloved violin.
2 years ago, I began to detect something going wrong, yes. And I couldn't read. All of a sudden, I was terribly upset. And I was always told naturally that for an operation, cataract operation, I would have to stay in the hospital for 3 days at least. And I had my share when I broke my hip with hospitals. I didn't want to go back to a hospital for anything.
Unfortunately, he's one of a group of people who are elderly, who are fearful of hospitals. And he knew he had cataracts, could not see, could not play his violin as he so loves to do, could not read, and was so fearful of a hospital that he just wouldn't go in the hospital.
So, Alfred Laura underwent the same surgery as this woman is about to have. Here, Dr. Dello Russo works with a fully trained anesthesiologist, not only for the initial workup, but during and after the surgery in the event of any complications. The convenience and efficient use of time in outpatient surgery are popular features with patients who choose it. The procedure is done under local anesthesia. After the patient has received a topical anesthetic, further numbing of tissue around the eye is done with a needle. The patient is awake throughout the entire operation and, in fact, carries on a steady dialogue with the doctor. The atmosphere in the small operating room is very calm. After initial preparations, Dr. Dello Russo then begins to work with a microscope, which is one of the major advancements in cataract removal.
We're just stitching part of the eye up now, and then we're going to open it up again a little bit later on.
Here you see exactly what Dr. Dello Russo is seeing through his eyepiece.
And what we're doing, opening the superficial lining of the eye known as the conjunctiva.
Less than 15 minutes have passed since Dr. Dello Russo began. After making the necessary incisions around the surface of the eye, he is ready to remove the clouded lens.
And there is the cataract coming out.
This is the cataract, an obvious roadblock to sight. After cleaning the area, Dr. Dello Russo is now prepared to insert a new specially fitted lens into the eye.
This is the lens. And you see that it has an optical portion. That's what's going to be in the pupillary area. There's a blue loop here, a blue loop there to keep it in position.
Then, with the same ease with which the cataract was removed, the new lens is inserted. It has been less than an hour, and this patient now has a new lens in place. Within a few days, she was seeing clearly. She expresses the same joy as Alfred Laura, who today happily reads his sheet music and performs the music that was his love and livelihood for so many years.
Wonderful, wonderful. I was happy that I was able to play. It was being born again.
Now, I cannot emphasize too strongly that any surgery outside the hospital involves certain risks that are minimized in a hospital setting. Furthermore, the usual controls and checks and balances that operate within a hospital may be absent. However, if the medical condition of the patient is good and if the staffing and equipment in the outpatient center are adequate, such surgery may be an appropriate alternative to hospitalization. Obviously, it is important to do some careful checking about the doctors and setting involved, just as you would for any surgery.